Please join me in welcoming Dr. Darilyn Moyer as she shares her insights with us today.
Thank you, Dean Ruboli. The title of my talk is Anchors, Propellers, and Wings, the Formula to Thrive in Medicine. But first off, I'd like to convey my great gratitude to the medical students of Cooper Medical School of Rowan University, class of 2024, faculty, and administration for the true honor to be with you and your loved ones on one of the most meaningful days of your careers in medicine. As I reflect on my own medical school graduation several decades ago, I remember less about the content of the talk, but more about how the talk made me feel. Inspired to begin my career, peppered with just a little bit of anxiety at the weight of people's lives on my shoulders. And in some ways, it seems more like 4 years, not 40 years, has flown by. Given the accomplishments of this graduating class, including the resilience you've demonstrated by your class being birthed into the beginning of a historic pandemic, embracing the leadership and service to your community in uncharted and challenging times, you are already on your way to impact in your careers. Anchors. As you take your career journey in medicine, reflect on the journeys that you've ambled on to get here and the values anchored in you that helped to sustain you. I used to think that the adage, you need to know where you came from in order to know where you're going, was kind of dated nonsense made up by someone who was stuck in the past. Through time, I've gained a little bit of wisdom, and I realized the values of caring about others, integrity, resiliency, empathy, and accountability instilled by my parents as I grew up poor in rural Pennsylvania would be a sustaining force to allow me to not just survive, but to thrive in a high-stakes, high-impact profession. I learned about the tremendous resiliency and care for others that the CMSRU class of 2024 demonstrated from day one when your class was birthed into this staggering pandemic. At a time when there was much fear for our patients, families, and friends, you stood up against the devastation of COVID to provide care for your communities with empathy and resiliency. When COVID vaccine became available, you stepped up to stand side by side with other healthcare professionals to assist in providing unprecedented numbers of people with life-saving and disease-attenuating COVID vaccines. At a time when some fled from healthcare professions, you faced down this deadly pathogen and leaned into providing care for others as a hidden in plain sight way to renew and reinvigorate resiliency to sustain you in challenging times. In fact, your total hours of commitment to the service to your community is a staggering 20,000 hours. As you venture into your careers that will have high and low moments, leaning into relationships and demonstrating care and empathy for others will armor your resiliency to navigate rough waters. But you must also remember to put on your own oxygen mask first, and remember to always care for yourselves. Humility is another anchor, and it should be an anchor for your career. A former medical school dean famously said to the med school graduates at convocation, "Congratulations, doctors. In 5 years, 50% of what we taught you will either be disproven or outdated. The problem is we don't know which 50%. Humility is an acquired characteristic that is more the wisdom of experienced physicians and non-physicians in the crowd know well. Medicine is a humility-inducing profession. You come out of medical school thinking you know a lot and quickly get knocked down a few rungs when you realize patients don't read the medical literature and don't always obey the rules. Despite doing what you and your colleagues thought was the data-driven, clinically indicated right thing for a patient may not have fared well. Humility is the ability to reflect upon and personally internalize lessons learned from adverse outcomes in your professional and personal lives. Humility is the ability to graciously and humbly accept feedback, fail forward, reflecting and learning from adverse outcomes and incorporating those lessons learned into your subsequent actions. In fact, practicing medicine is hard. You learn more from reflecting on failures or near misses than when all goes right. In people and patient care, we strive to get it right every time because it literally could make the difference between life and death for our patients. Professionalism is another anchor, and there's no doubt that it's a foundational concept in medical education, and it has grown and been refined. Professionalism, simply defined as doing the right thing at the right time for the person in front of you. I always try to invoke the grandparent rule. At every turn, treat the person in front of you exactly the same way you would treat a beloved family member. In order to do best by patients at every turn, aptitude, like attitude, is crucial. The pace of medicine and the tsunami of new and changing information means we can never rest on our laurels and need to stay current in our domains of practice. Keeping up in your practicing domain is crucial. We need to be humble and graciously accept feedback and incorporate it into our practice. Speak truth to power when you see problems with patient care and healthcare inequities. This is truly professionalism in action. Propellers. So I think that curiosity is a tremendous propeller in your career. With each encounter in the course of your life, both personal and professional, remember to be curious, as everyone has had a different lived experiences and challenges in our healthcare system. There is no better way to diffuse a challenging or potentially challenging situation than invoking your very human curiosity to assist in getting the right diagnosis, forging a relationship, getting an off-the-rails situation righted. There's a famous piece from the Annals of Internal Medicine from 1999 written by Dr. Faith Fitzgerald entitled Curiosity. Here's an excerpt. When I was a young attending at San Francisco General Hospital, morning rounds usually consisted of briefly going over 50 or 20 patients admitted to the team the night before and then concentrating on, quote, the interesting, unquote, patients. I was righteous and determined to teach the house staff that there were no uninteresting patients, so I asked the resident to pick what they would characterize as probably the least interesting patient that was admitted overnight. He chose an old woman admitted out of compassion because she had been evicted from her apartment and had nowhere to go. She had no real medical history, but was simply suffering from the depredations of antiquity and abandonment. I led the protesting group of house staff to her bedside. She was monosyllabic in her responses and gave history of no substantive content. Nothing, it seemed, had ever really happened to her. She had lived a singularly unexciting life as a hotel maid. She could not even or would not tell stories of famous people caught in her hotel in awkward situations. I was getting desperate. It did seem that this woman was truly uninteresting. Finally, I asked her how long she had lived in San Francisco. Years and years, she said. Was she here for the earthquake? No, she said. I came after. Where did she come from? Ireland, she answered. When did she come? 1912. Had she ever been to a hospital before? Once. How did that happen? Well, she had broken her arm. How had she broken her arm? A trunk fell on it. A trunk? Yes. What kind of trunk? A steamer trunk. How did that happen? The boat lurched. The boat? The boat that was carrying me to America. Why did the boat lurch? It hit an iceberg. What was the name of the boat? The Titanic. So that really shows that everyone has an important story to tell. So curiosity will keep you interested and interesting in your life, and may also help you figure out a diagnosis or save someone's life. Always remember to be curious and ask your patients, what are you worried about and what do you think is going on? Tell me about your journey in trying to seek care in the past. Hearing patients and their loved ones' concerns may lead to a conversation that may help you gain insight into the patient's diagnosis and save their life. Gratitude should also be a propeller. As newly minted physicians, you should be grateful to be part of this humbling and life-changing profession. Remember to embody gratitude as you journey through your personal and professional lives, and seed it with grateful acts of random and not so random acts of kindness. Remember that on your journeys, many will pack your parachute. Get to know the names and stories of all of those around you. You'll be surprised about how paying it forward will pay you back in dividends along the way. Take the opportunity to lift up all around you. Now, please take the opportunity to thank those around you who supported you in your long journey to become physicians. Please join me in applauding all who are with you today who pack your parachute. Authenticity is another propeller. Always bring your authentic self to work. It's just too hard to try to fake it until you make it. Tell your story and listen to other stories. See others and be seen. And try to push back that systematically engineered imposter phenomenon. Notice I didn't call it imposter syndrome because it's not about you, it's about the system. And that may plague you throughout your life. I still get a little bit of my imposter phenomenon when I hear introductions of myself. Authenticity, including stopping, thinking, and asking when you are uncertain about the course forward, will humanize you and may just help you save someone's life. Letting some of you show through, while of course following important boundaries of professionalism in your encounters and in healthcare, will endear you to your patients and colleagues. The last section is about wings. Who's gonna fly it, kid? Famous words from the first entry into the Star Wars film dynasty. It's a story of developing wings of expertise, and incredibly relevant to the transformation that you will all experience as you begin to truly feel like you are a physician. While your degree of Doctor of Medicine is happening today, data demonstrates that you're truly not going to feel like you are a physician until you experience a transformational moment early in your residency. This transformational moment typically occurs after a particularly intense patient situation for which you may have played a prominent role. The shaking off of, am I really a physician imposter phenomenon, and finally feeling like a real physician could be after a saving someone's life, preventing a significant deterioration, or simply holding a patient's hand and supporting them through disclosure of a difficult diagnosis or in their last moments of life. I still vividly remember the moment I finally felt like a real physician. I trained in internal medicine at an incredibly intense program. We spent every third night in the hospital, and upon entering our second year, I worked with a fourth-year sub-intern. But my upper year residents had given us our wings. It was a wallet-sized car that we always carried with us, and it signified that we were able to fly out of the nest. In my first month as a second-year internal medicine resident at my program's community hospital, I got a call from my fourth-year sub-intern. He had been called to see a patient with chest pain, and he told me that there was something on the ECG that looked like tombstones. Now, some of you recognize that this is a classic description of someone who's suffering a myocardial infarction or a heart attack. Within a few moments of unplugging the patient's bed, wheeling him to the CCU, and ultimately having to defibrillate him and give him CPR, we were able to save his life and eventually watch him walk out of the hospital. That was the night I got my wings, truly feeling like a full-fledged physician. Resilience. Resilience is the force that will sustain you through a career that will witness much suffering and unspeakable situations. Nonetheless, you must have the resilience and elasticity to bend without breaking. Cultivate the resilience to acknowledge the grief and adversity you will face, reflect, process, compartmentalize, reframe, and move forward. While all in medicine know that medical liability and malpractice allegations are mostly part of an unspoken side of medicine, like Voldemort in Harry Potter novels, its name is really not spoken. What I want to tell you is that if you care for enough sick people over the course of your career, it's likely that you're going to be involved in a medical liability action. And when it comes, you'll have the choice of how you play that hand of cards that you are dealt. It may be surprising, it will be almost paralyzing at times, but it can and should be an opportunity to exercise in reflection, resilience, and recommitment to the values of the medical profession. While individual physicians are named in medical malpractice cases, we know that it is unusual that one singular action by one clinician resulted in a bad outcome or death of a patient. It's typically multiple system and individual factors that line up to result in bad outcomes. Remember that medicine is an art and a science, as Dean Riboli just told you. Despite doing everything right, patients can have unanticipated complications and outcomes. Your ability to learn from adverse experiences and near misses, like with other challenges, reflect on what you will do and work to change the greater system of healthcare to prevent adverse outcomes in the future for patient care. It's important to reflect upon and then compartmentalize this adversity that you're going to face in both your personal and professional lives so that it does not and cannot prohibit you from all the good you have in you for patients. Leadership gives you wings. The literature is rife with famous quotes and leadership books, etc. I won't cite great leaders here. You're all quite adept at looking things up by now. What I'll say is that leadership is not taking charge of people, but taking care of those in your charge, especially in the face of adversity. Leadership is truly a marathon, not a sprint. Leadership is about making difficult choices, as we have seen in our brave frontline healthcare professionals who faced COVID-19. Advocacy and how you can and should be advocates for your patients and your communities gives you wings. The rapidly diversifying community of those practicing medicine means that we need to work together to systematically change the structures and culture of medicine which do not allow us to get to just, equitable, and inclusive environments and outcomes in healthcare. We need good outcomes for all. Advocacy means to galvanize, to be the change that you want to see in the U.S. healthcare system, and starts with the patient right in front of you. The COVID-19 pandemic ripped open the seams of the U.S. healthcare system and the need to fix the dysfunction and inequities we increasingly bear witness to. Advocacy is going above and beyond to reach out and serve patients, as you have demonstrated in your exemplary service to your own community. It will give you the resilience and sense of belonging that will allow you to not only to survive, but to thrive in your careers. As your class president, Ernest Wallace, told me, quote, "One unique experience we had as a class was getting to know each other while volunteering at the COVID-19 clinic. Most people get to know their classmates through social events, but our greatest bonding experience was working together, serving patients in that COVID-19 clinic." Two last pieces of advice. Be relentless in finding coaches, mentors, and sponsors, the people who talk at you, with you, and about you in a good way over the course of your career. In turn, pay it forward by coaching, mentoring, and sponsoring others. Lift as you climb. Finally, see patients and colleagues for who they are and help others to aspire to careers in healthcare. Let them see what they can be, as you have all done so remarkably. Coming from a poor family where none of my immediate family members went to college, let alone medical school, I was inspired by my pediatrician, a female physician in the 1960s and 70s in rural Pennsylvania. She saw me. She saw my potential and facilitated me becoming what I could not see. Finally, a hearty note of congratulations to all of you and all who journeyed with you to get to this important moment of your lives. as you're sent on your way to get out there and practice this humbling and amazing art of medicine, I hope you will build something that outlasts you. What will you do with the power in your wondrous and finite life practicing medicine? How will you use this incredible platform for influence and impact? And please don't forget the amazing leaders and mentors that you've had at CMSRU. Your class has been lucky to have leaders such as Dr. Steve Treziak and Anthony Mazzarelli, authors of Compassionomics, the revolutionary scientific evidence that caring makes a difference. They convey that the prescription for exemplary patient care is clinical excellence infused with copious doses of compassion. Finally, remember that there will be challenging times ahead. But as John Lennon famously said, life is what happens when you're busy making plans. Along your journeys, remember your anchors, propellers, and wings, and may the force be with you. Thank you.